name is Susan Etherton. I'm here trying to explain CPR procedures. We're going to use a fake little bear here for our example today. The first thing you want to do when a patient comes in is to assess your patient. Is your patient breathing? Is their heart beating? Do they have a pulse? So you're going to want to take their vital signs. So the first thing you're going to want to do is to see if they're breathing. Is their chest rising and falling like it should? And be able to write that down or keep a mental memory of that. The next thing you're going to want to do is to see if that heart is beating. Now with the dog, you're going to be listening on the left side of the patient to be able to hear whether the heart was beating. You also want to be able to put your hand on the middle of their in the middle of their thigh to feel their femoral vein to see if you can feel a pulse as well. This would be very important to know about how the blood is circulating through the body. If you hear a heartbeat but not a pulse, could be very important information for your doctor. So my patient at the moment is not breathing, but its heart is still beating and it still does have a pulse. So the first thing I'm going to want to do is to intubate my patient. So I'm going to get the proper size tube. I'm going to know this by checking that with the septum of the nose of the patient and if it's the correct size. The next thing I want to do is to test my tube to make sure that it's working properly. I insert the syringe and blow it up and test the pilot balloon with the actual balloon that will be inside the patient. I will then lubricate the end of this tube, and as I have somebody to help me, I will be able to open the airway and be able to intubate the patient and secure that tube into place. The patient needs to be in lateral recumbency as we're going to start to put the animal on oxygen. In this circumstance, I'm going to be using an ambu bag. The ambu bag is going to help to inflate the lungs so that the patient's getting sufficient amount of oxygen into the lungs to keep the body functioning. You're going to give a nice press into the ambu bag so that the chest will rise at a good level and then release. Make sure you give a nice even breaths so that the patient is getting enough oxygen but not being over-oxygenated at the same time. The way to check this is to check the mucous membranes. Just like with us, you can look at the gum line, you can look at the lip line. You want to see a nice pink color. So you want to press into them, see your capillary refill time. Is it 1 second, 2 seconds? That's around normal. If it's anything prolonged more than that, then that is an area that could be dangerous for the patient. Say, for example, I have the patient who's in cardiac arrest. That means that the heart is not beating anymore and I do not feel any kind of femoral pulse. In that aspect, we're going to want to start compressions as soon as possible. As you start the compressions, you're going to want to lean down onto the patient just below the 2-finger list below the sternum. Again, this animal would be in lateral recumbency, and depending on the size of your animal would depend how you would do these compressions. For this size of a patient, which would be like a cat, their chest cavity is very fragile, so you're going to want to use your hands. So you put your fingers on the bottom, your thumb on the top, and lightly compress down into that chest wall and collapse that chest wall to make that heart pass the blood through. You're going to want to give 5 to 10 compressions at a time and then give the animal 1 breath. If your animal is a little bit larger, like a medium-sized dog, pretend like this is the chest cavity of that dog, you're going to be wanting to use your hand on the bottom and your hand on the top to make those compressions. Again, you're going to want to lean down a little bit harder so you can be able to compress that chest cavity a little bit more than you would with a kitty cat. We also have our large dogs, which can be anywhere about 50 pounds or more. They're going to need significant more pressure. This pillow is an example of what the chest size would be of a larger dog. So again, they'll be in lateral recumbency. You're going to find their sternum and then go 2 inches above. Press one palm down, the other palm on top of that. And with your motion, be able to press down, keeping your elbows at a good state where they're not too tight or too relaxed. So you give a nice firm pressure into that chest wall, compressing that heart. As you're doing this, you are going to be giving the breath, so you do 10 compressions and 1 breath, 10 compressions and 1 breath. As you're doing that, you will stop after 5 rounds take the vital signs, and see if your patient is back. During this whole time, there will be one person generally doing the breast, one person doing the heart, another person on the side also monitoring everything that is going on, all the injections that will be given. The doctor may want to give epinephrine, may want to give atropine, depending on the circumstances that are going on. So those are basically most of the skills that we have to go through. There are some other tools that you can use to help you for intubating your patient, which I forgot is a laryngoscope. When you open it up, it gives a nice lighted airway to help you to be able to get an airway to be able to get that the ET tube down into the throat to help you to breathe as well. So there's a lot of different tools and a lot of important factors that come into place to doing CPR, but these are just a few that I've learned.